Do you want to know how to have an easier, quicker labor and delivery? Of course you do. Who wouldn't? Stick around, my friend, because today I am sharing some tips on how to prepare your body for labor and delivery. These are all things that I did to prep for my first baby that resulted in a labor that was less than 8 hours as a first-time mom, which is pretty quick. So if you want to know more, then let's get started. By the way, if you're new to my channel, my name is Jess. I am a mom to a 21-month-old toddler, and I am currently 37 weeks pregnant with my second baby boy. I help moms of little ones navigate the world of early motherhood by sharing videos on pregnancy, parenting, and early childhood. So be sure to give that subscribe button a click along with the notification bell so that you never miss out on any of the fun. The first way to prep your body for labor is to drink red raspberry leaf tea. I talked a little bit about this in my second and third trimester pregnancy must-haves video, but I absolutely love red raspberry leaf tea. Keep in mind, this is not a raspberry flavored tea. It is raspberry leaf tea, so there is a difference. So make sure that if you're going to buy this, you're getting the right thing. I'll link the brand that I use and love down in the description box below. This tea is supposed to have so many benefits for preparing your body for labor. It's said to help strengthen and tone the uterus, shorten the second stage or the pushing stage of labor, and enable more effective contractions. Hello, sign me up. It also has great antioxidant properties, and it is filled with vitamins and nutrients, so it's just great for your overall health. I actually take it after my pregnancy as well because it's supposed to be great for breastfeeding too. By the way, just a disclaimer, I'm not a doctor or medical professional, and nothing in this video is to be taken as medical advice. Always talk to your doctor or healthcare provider before making any sort of change or adding anything into your pregnancy to make sure that it's okay for you and your own personal situation. Typically, you want to avoid red raspberry leaf tea in the first trimester because it can cause uterine contractions. For my first pregnancy, I'm pretty sure I started really late, definitely after 30 weeks. But this time I wanted to start drinking it a little earlier, so I drank a cup a day starting at 19 weeks, and I just started adding another cup at around 35 weeks. So once I hit 38, I'll probably increase to 3 cups a day. But again, talk to your doctor or midwife to make sure you're clear to consume this. Exercise during pregnancy has so many benefits, and that includes prepping your body for labor and delivery. Exercising while pregnant can result in a shorter labor, fewer medical interventions during labor, and less exhaustion during labor. Last pregnancy, I walked on the treadmill most days of the week, and while that was good, that's great if you're just walking, that's totally fine. I wanted to do a little more this pregnancy. So I have been doing a pregnancy weight training program 3 days a week, along with some supplemental cardio this time around. I feel a lot stronger at this point of my pregnancy than I did last time, and I am definitely confident that I will feel that way in labor and delivery as well, but we'll see. One thing I've been doing new this time is like random deep squats. So if your baby's head down, this is great for engaging baby deep into your pelvis. Deep squats also help to open up your pelvis while strengthening your pelvic floor muscles, which are all those muscles that you're gonna be using to give birth. So I will do these randomly throughout the day, kind of like while I'm brushing my teeth or something. I'll even sometimes like hold onto the counter and just go really, really low, like almost down to the ground, and then use my muscles to really concentrate and push myself back up. So that's something that you might want to consider trying as well. But if you're clear to exercise throughout your pregnancy, I would absolutely try and exercise for as long as you possibly can, because I really do think that keeping active does make a difference during labor. They say that labor is like a marathon mentally and physically. So it's almost like you're training for your marathon. So think about it that way. Eating dates about 3 to 4 weeks from your estimated due date has been said to help shorten labor and ripen or prep your cervix. So I read on mamanatural.com that you should eat 70 to 75 grams of dates daily from 36 weeks on. So that's what I've been doing. I did it my first pregnancy. I personally really like dates by themselves, but if you don't, there are a ton of different ways that you can eat them. So I just get this big case from Costco and I eat them from 36 weeks until I give birth. If you're like a fan of nut butters, like peanut butter or almond butter, that's even great if you're not a fan of the taste alone. I had that yesterday and they were so good. I don't know, I really like them. They're a fruit, they're sweet. Some people don't like the texture or just can't stomach eating that much. You do want to be careful with dates if you do have gestational diabetes because they are a little high in sugar, but they're also really nutritious. They have a lot of fiber in them and a lot of vitamins and minerals. So definitely check them out. But like I said, be careful if you do have gestational diabetes with those. You probably don't want to eat them, or at least talk to your doctor about how much you should be consuming. Sitting on a birthing ball is a great way to prep for labor. I absolutely loved using my birthing ball for both my pregnancy and my labor, so I highly recommend getting one if you don't already have one. A birthing ball is great for opening up your pelvic area and allowing baby to get in that optimal position, which can help the birthing process go smoother and faster. It also helps to strengthen your back and stomach muscles. I really like doing this exercise where I kind of like spread my knees apart with my feet firmly planted on the ground, and I kind of do this little like hip rolling thing. So I just roll my hips around in a circle, back and forth, and I do that for a little while. But I will sit on this even at night while my husband and I are watching TV and kind of winding down before bed. And I'll just sit on it and do some gentle bouncing or sway back and forth. It's just really nice for mobility, keeping your pelvis open and stretched out. So if you don't have one, I would highly recommend getting one. I actually brought mine to the hospital. I am tall, I'm 5'9", so I did buy a larger one so that it would be a little more comfortable for me. And I wanted to make sure I had it at the hospital because they weren't guaranteed. I knew I didn't want an epidural with my first pregnancy, so I definitely wanted that as something to help me labor. So if that's something on your radar, then definitely consider buying one. Evening Primrose Oil has been said to play a part in softening the cervix, which is really, really important for going into labor. Some studies also say that it can help shorten labor as well, but I don't think there's been enough evidence for this to be proven. But Evening Primrose Oil comes in a capsule. It does have liquid inside because it is an oil. So you have the choice to take this orally as a pill, or you can insert it vaginally. Just a word of caution, Evening Primrose Oil is said to have blood thinning effects. So because you're taking this at the end of your pregnancy and close to delivery, I personally prefer to insert it vaginally. That's how I apply it. I don't take it orally. So starting at 38 weeks, I'll poke a hole in the capsule and insert one capsule vaginally every night before bed. And you wanna put it as deep as possible because you wanna get it as close to your cervix as you can. So if you choose to do this, I recommend going to bed with a panty liner on because it does get a little messy in the morning because it is an oil and the capsule itself will disintegrate overnight. So it can kind of like leak out and kind of get all over the place. As with everything, definitely talk to your doctor about this before starting it. You can take it orally, but like I said before, there are some more side effects that come with doing it that way. So I just like to apply it directly to the source. To prepare for your labor, you definitely should be researching some breathing techniques and practice them. Even if you're planning on having an epidural, this is a great technique to have in your back pocket because you'll probably experience some kind of pain before you get an epidural. Also, things happen and there are times when you plan on having an epidural and can't get one. So practicing different breathing techniques is a great way to prepare. I took a hypnobirthing class and the instructor talked about up breathing, which is when you breathe in slowly for a count of 4 and out of your mouth for a count of 8. So this is a really great one to keep in your head to help you manage those contractions. So you would just breathe in slowly for 4 and then out for 8. And I just like, even just doing that like made me feel more calm. So definitely try that one and look up different breathing techniques that you think would help you as well. All right, we're getting a little saucy here. My next tip is to get busy with your partner. I know the thought of sex may be the last thing on your mind being so pregnant, but it can help to prepare your body for birth. Plus, it's a great way to deeply connect with your partner before baby arrives and things get crazy. Orgasms actually help to strengthen the pelvic muscles, which can help make contractions more effective and aid in postpartum recovery. Semen also contains hormone-like substances called prostaglandins, which are actually used to ripen the cervix during a medical induction. So it's possible that having sex can have this type of effect on the cervix as well. Like I said, if anything, this is a great opportunity to get close with your partner before baby arrives. So if you feel up for it, definitely go ahead and try and enjoy it as much as possible. Learning acupressure points can have tons of different benefits before and during labor. Different points on your body can help do things like minimize pain, induce labor, and even help to get baby in an optimal position for birth. I highly recommend looking these up. I'm not going to talk about any today because quite honestly, I need to go over them myself again, but I found these to be super helpful during my last pregnancy and birth, especially for pain management while I was in labor. So definitely go ahead and check out some acupressure points. If the thought of a human emerging from your body gets you a little nervous, you're not alone. One common fear many women have is the fear of tearing from childbirth. Something you can do to minimize your chances of tearing is to perform perineal massage. You may be saying, peri what? Your perineum is the area of tissue that's located between the opening of your vagina and your anus. So perineal massage is when you stretch and manipulate the perineal tissue in order to prepare it for childbirth in an attempt to prevent tearing. So you can do this on your own or with the help of your partner. I know it's not the sexiest thing in the world, but it definitely can help. So if they're willing, then definitely go for it, because this is really hard to do when you're super pregnant, in my opinion. You can look up this technique online, but honestly, I definitely think it's worth trying. I still tour with my first and I did lots of perineal massage, but I definitely feel like it helped me. Usually you start this around 36 weeks of pregnancy for up to 5 minutes every other day. Look into this though, because if you want to try and prevent tearing, this is probably the best thing you can do, especially if you're a first-time mom or you haven't had a vaginal birth before. Pelvic floor muscles have a very important role. Not only do they play a vital part in birthing your baby, but they also help to hold your uterus, your bladder, and your rectum in place. These are also the muscles that prevent you from peeing when you laugh, cough, or sneeze, which can be a pretty common issue after pregnancy. So how do you keep these muscles strong? The answer is Kegel exercises. Kegel exercises engage and strengthen your pelvic floor, which is a group of muscles and ligaments that hang between your hips. The goal is to contract and relax these muscles in short sets a few times a day. If you've never done this before and you're not sure how to tell if you're working the right muscles, then next time you go to the bathroom, try and stop your pee by contracting your muscles. Those are the same muscles you use for Kegel exercises. I actually have an app on my phone for this that's free. I'll try and link it down below. I don't even know what it's called, but there's a ton of them, and I just do a couple of sets a day, but you don't even need an app. You can just do it on your own. A good place to start is by squeezing for 3 to 5 seconds and then releasing for the same amount of time, and then work up to 10-second squeezes. Also, definitely do these right after having baby, as it will help speed up the healing process by stimulating blood flow, and it will also help to strengthen that pelvic floor at the time that you need it most. Go check out my labor and delivery playlist for even more helpful videos on labor and birth. If you found these tips helpful, then please give that thumbs up button a quick click and let us know in the comments what you're doing to prepare yourself for labor and delivery. Also, don't forget to click that subscribe button before you go. I am sending you all of the good vibes for a quick and easy labor and a positive birth experience. Thank you so much for watching, and I'll see you next time.